When Medicare was established in 1965, it was created with two main components. Medicare Part A was created to cover hospitalization, while Medicare Part B provides various types of outpatient services, including visits to the doctor's office. These together are often referred to as Original Medicare. In the 90s, Congress added another option, known as Medicare Advantage or Medicare Part C. While the first choice someone makes will be in choosing between Original Medicare and Medicare Advantage, other decisions are right behind. I'm Tim O'Mara with the Nationwide Retirement Institute, and this is Healthcare, Planning for Costs in Retirement. The enrollment window for Medicare begins 3 months before the month of a person's 65th birthday through the 3 months immediately following that birthday month, a 7-month window to enroll in coverage. At that time, everyone is guaranteed the right to purchase a Medicare supplement for Parts A and B or a Medicare Advantage plan, regardless of any pre-existing condition. And private insurers who sell these supplemental and Medicare Advantage plans are not able to charge more because of a past or present health problem.
One question we often get is from people who are working past age 65 and still have health insurance through their employer. If you continue to work and like your health insurance, you can absolutely keep it and also apply for Medicare on your 65th birthday. In this event, you would be dual covered, and Medicare and your employer-provided plan would coordinate the coverage you need. But if you work past age 65 for an employer with 20 or more employees, you may also choose to delay enrollment in Medicare altogether until you retire. In this circumstance, you would delay Medicare enrollment until what is known as a special enrollment period.
For those who opt for Medicare Part C, those plans are administered at the state level, and coverages can vary depending on which state you live in. But Original Medicare is administered at the federal level. While Original Medicare covers hospitalization and most types of outpatient services, including doctor visits, it doesn't cover everything. That is why Medicare advises people to look into secondary insurance.
Medicare secondary insurance is available in two basic forms: prescription coverage, which is also known as Medicare Part D, and supplemental insurance, also known as Medigap policies. Both Medicare Part D and Medigap policies are available through third-party insurance providers and cover the additional healthcare expenses generally not covered by Parts A and B.
Prescription and supplemental insurance options require a thorough understanding of what they cover. Certain Part D prescription plans, for example, may only cover specific medications. So what's right for one person may not be the best choice for another. The Medicare decision may involve a lot of lifestyle factors, and that's why it could be a great opportunity for financial professionals to engage with clients and discuss their ideas and goals for life and retirement. In Part 3 of this series, we'll look at the cost retirees can potentially expect and more.